So this here is the anterior of the bird. This is the breastbone. You can actually feel what's called the keel. It's actually an extension off of the sternum. We, of course, are focusing on the leg, right? One of two legs if you happen to have a chicken like this. All right. All right. You're going to get a little bit more than just how to identify A and P today. You're going to learn how to quarter a chicken, pretty much. Okay, so if you have a whole bird, what you want to do is pull the leg away from the body, so laterally away from the breast meat here, which are actually the pectoral muscles. And you want to take your knife, and without sawing, you want to make a cut, right? So there's actually quite a bit of space between the skin and the rest of the muscles. Okay, so just one slice here, cutting through the skin. Right, and right, we are looking to get all the way back to the joint back here. Hopefully you guys can see that here. And so just again, gently cut around, right, in general, without sawing motions, cut around to essentially where the muscle, where the meat meets the spine, okay? All right. So at this point, the leg is pulled laterally away from the body. The next thing we're going to want to do is essentially find the hip joint. Now, if you feel the back of the chicken here, this hard structure right along the midline of the body is the pelvis. Their pelvis is actually a lot longer, a lot taller than ours is. All right, and so if you feel along the leg, you'll feel that there's actually a little bump and then an indentation right where the pelvis meets the femur, right? So the acetabulum meeting the head of the femur here, right? What you're going to want to do to start to separate the leg from the rest of the body is push on that bump, which is actually the greater trochanter of the femur. All right, so you push on the greater trochanter while you pull the knee away from the body. Okay, so this motion, and what you're doing is you are separating the head of the femur. All right, so this is the head of the femur. Here's the greater trochanter away from the hip bone. Okay. All right, so now we have leg muscles, we have abdominal muscles right here, and the joint has been dislocated. So what you're going to do from here, whether you're doing a dissection or you are quartering a chicken, because it's so much cheaper to buy a whole chicken than a chicken already cut down, you are going to essentially follow this line, right, separating the leg muscles from the rest of the body. Okay, so again, watch your fingers. But now you have a separated leg. Okay, with the rest of the chicken, of course, you can simply cut along the keel, the breastbone, and separate away the rest of the breast meat. This could be dinner. It will be my dinner today for sure, as weird as that may sound. Okay, so now what we have is a leg that should look like, any other leg that you would get from the grocery store. First and foremost, before we actually start identifying things, let me orient you again to the body and the leg. One of the things you have to tell me for this dissection is whether you have a right or left leg. Now, of course, if you got a whole chicken, you know that this here is the chicken's left leg. All right, but if you got a package of already separated or disarticulated chicken legs, how are you going to tell? Well, remember that this here is the head of the femur, okay? And so this, just like on our own body, has to point medially. Also, all of this muscle and connective tissue is of course not exposed to the outside world, right? The skin is exposed to the outside world. And so this is the lateral side, and this, the head of the femur, is the medial side. And so, right, if you kind of orient it with your own body, or in this case, with the chicken itself, you'll see that the chicken's left side is this left leg. Okay. Okay, so now let's start walking through what we see. All right, just to orient you, this is the thigh, right? We normally call it a thigh, and we normally call this a drumstick. This is just like our thigh. This is just like our calf. Okay, so this is the hip joint. This here is the knee joint. Okay. The very first thing you're going to start to do, dissect this specimen, is you're going to start pulling the skin back. All right, so this here is the skin. It's a little bit easier to remove. It's less attached than human skin would be, but we can still get a pretty good idea. All right. All right, so here is the epidermis and the dermis. The epidermis actually is this like yellow stuff on the very surface. A lot of times it's removed during the processing steps. All right. Deep to the skin, you'll feel it's kind of slimy. This is fascia, and we can actually see that there is connective tissue. Right, so this right here, there's slimy connective tissue that is actually fusing the skin to the underlying muscle tissue, right? Just like it would be in a human, right? And so this here is fascia, okay, and that's one of the structures that you're going to need to point out to me. What we also see within the fascia is that in some places there is this kind of whitish, yellowish connective tissue right here. Okay, this therefore is loose adipose connective tissue. Okay, again, something else that is on the list that you need to tell me. All right, so all of this stuff here is loose adipose connective tissue. Okay. All right. So maybe at this point you would take a photo and tell me, you know, this is a left leg. Here is the skin. Here is the fascia. Here is the loose adipose connective tissue. Okay. Once you have that established, once you have that photographed or videoed perhaps, from there you're going to start gently removing the skin. Okay, so again, nice gentle movements. Be very careful, especially if you're using a crazy big knife like I am. Okay. All right, so you are pulling back on the skin and simply cutting away gently at that fascia. Okay. Note that in the popliteal region, right, so behind the knee, there is a lot of adipose, right, so lots and lots of this gooey fatty tissue, okay, and it's going to be a little bit more difficult to remove the skin from that area, okay. Hopefully you guys can see my finger through the fascia right here, all right, so now I have separated away the skin, can puncture the fascia, and cut along the muscle. We're not trying to cut into the muscle, all right, so cut along the muscle between the skin and the muscle tissue itself. Okay. All right, so what do we have now? Again, this is the hip joint. This is the femoral head. Okay, we can see around in this joint that there is some white tube-looking structures. All right, so this right here, right, actually still has a little bit of blood in it. This is a blood vessel, right? Note that it is very close to the hip joint right here. Okay, blood vessels are one of the things that you need to point out to me, right? So this right here is a blood vessel. All right, and just to give you a little bit of perspective, let me show you a model real fast. A model not of a chicken leg, but of a human leg. Okay. Again, need a clean hand here. Okay, so this is our model of a leg. All right, this here is the femoral head, right? Just like we see down here on the chicken, the femoral head. Running right along the femoral head, or right out from the hip joint here, we have red and blue tubes. Those are arteries and veins. We also have yellow, that is a nerve. That's the femoral nerve. And so in the chicken leg, just like in our leg, arteries, veins, and nerves are going to run together past the hip joint, right? And if we were to remove some of these muscles here, we would also see that the nerves, arteries, and veins pass deep to the muscle, just like they would in the chicken leg, and through the popliteal region, so through the back of the leg. And so when you're trying to find blood vessels to show me for this dissection, you can either find them around the hip or you can find them around the knee. Those are probably the easiest places that you'll be able to locate them. Okay. If there are any questions, by all means, let me know. Don't want to go too fast or too slow here. Okay. All right, so those are blood vessels. All right, what we can also see is that there are some muscles that are essentially attaching to the femur as well as to the tibia and fibula from the posterior side. All right, so these would therefore be hamstrings. All right, so hamstrings, if we look back on that model, the leg model over there, we would see that the hamstrings pass from the posterior side of the hip, right, which we cut it off the hip, and they're going to attach to the tibia and fibula on the posterior side. Right, so anything on the posterior side of the femur are going to be the hamstrings, and they help the chicken to, of course, flex at the knee. So these muscles, when we pull on them, right, it actually pulls on the leg, right? So again, a straight leg, when we pull on the hamstrings, it flexes at the knee, just like in humans. On the other hand, right, if we look at the anterior side, right, so this is like the front of the thigh here, here's where the knee is, these are, actually this is the sartorius and the quadriceps and the tensor fasciae latae, all on the anterior side. And so if the knee is bent, right, so the chicken is sitting, they can pull the leg out. They can kick the leg out front. Okay? So quads and hamstrings are important to tell me on this, on your dissection. Okay? Finally, looking down to the calf, we can see that there are muscles that are pretty much all the way around the drumstick, as we know. The gastrocnemius, right, so the calf muscles on the posterior side, are important for this particular dissection. And so what I want you guys to do is to follow these little white lines. Right? These white lines are essentially the epimysium, right? So this connective tissue sheath that is surrounding the muscles themselves. Right? So if you just take even like the back of the knife, you can actually cut some of that fascia, and this is a super dull knife, maybe that's what you're working with as well. But you are simply separating those bundles, trying not to cut the muscle itself. Right? And ultimately, you'll be able to squeeze your finger between the muscles, right, that should be still intact, so that you can see individual muscles. Okay? All right, and if you look for some supplemental chicken leg dissection videos online, most of the videos that I have seen that show this process have you guys separating out every single muscle in this leg. For my purposes, you do not need to do that. I just want you to experience that these muscles are bundled together, right? We can see that there are actually tendons, another one of your terms, that are essentially extending down at the base of every single one of these muscles and ultimately attaching it to the foot, right? All right, so this here, these white shiny structures are tendons, okay? And they are at the base of every single muscle. In fact, if we continue removing the skin here, okay, do lots of connective tissue down here in the ankle. Yes, this is the ankle. We think of a chicken foot as being a leg, but it is in fact a foot. Okay. So remove the skin, and we can see tendons all the way down to the bottom here. And I'm trying to separate one out for you so you can see dependently. While I'm fighting with this, does anybody have any questions for me? Okay. All right, so again, you can separate all these out if you want, but here are tendons. All right, they're very shiny. Remember that this is dense, regular connective tissue. So if you look super close, you'll see actually that there are little shiny little silky lines. Those are collagen fibers. Okay, and so these are what would actually insert on the foot, which would be down here. Okay. All right. Very good then. So once we've figured out the different muscles, right? Quads, hamstrings, gastrocnemius, tendons. Now let's actually start digging a little bit deeper. All right, what we want to do is find the knee joint. Right? So of course you can flex and extend the leg, and in doing so, you should be able to see that there is one spot, right, that gets a little bit wrinkly when the leg is extended. This means that essentially the muscles, the connective tissue, are firmly attached to the bone in this area, and so that is part of the joint. Okay, so what you're going to do is essentially find the back here. Right. Find the popliteal region. Okay, so hamstrings and gastrocnemius coming together here. This is the popliteal region right in the back of the knee. Right. With that, you are going to, again, very carefully make incisions towards the front of the knee, towards the anterior of the knee. Right, so coming in from the popliteal towards this little wrinkly spot here where the knee is. Okay. All right, and again, this is exactly what you do if you were processing a chicken, quartering a chicken for dinner. Okay. So we're just kind of trying to separate away those muscles. There's always fat and connective tissue that is at the borders between the two muscles. And so you can just kind of cut around that. Okay, so as you continue cutting, making very gentle incisions, you should start to be able to see the femur and or the tibia. All right, so I have cut away some of the synovial joint capsule. So that's what this is right here. Okay. Also, it's not on your list, but this here is a collateral ligament, essentially connecting the outside of the femur to the outside of the tibia. Okay. All right. So going in a little bit deeper, we don't want to just cut it and separate it apart, right? We want to actually see what the heck is going on inside these knee joints, right? So I'm just cutting the muscle away from the knee on all sides. This is anterior and wrapping around to posterior once again. Okay. Very gently, so that hopefully soon, right, we can see what the heck is going on inside the knee. All right, so if you look at diagrams in your book, you'll see that the knee has actually quite a bit of fat around it for extra padding and protection. Okay, and so that is actually what I am cutting through right now. That fat pad, that fat capsule within the knee. Okay, so this is fat, right? All right, note that at this point, most of the cutting is just very gentle, very small, as opposed to the first cut to remove the leg from the hip. Okay, so hopefully, in one of these different perspectives here, we can see the femur and the tibia. Sitting on top of the tibia are menisci, right? So this little flap of connective tissue that if you feel with your fingers is actually pretty hard, like a lot harder than the muscle tissue, than the fat tissue, even those tendons, right? So it's very hard. This is a fibrocartilage disc, right? Just like the ones in your intervertebral discs. This is a meniscus, okay? And so we will see one of these between the medial and lateral the medial condyles of the femur and the tibia. And we will see one, although it might take a little bit more digging in this particular specimen, but between the lateral condyles of the femur and the tibia here. Okay, so again, just for a little bit of perspective, this is the leg, here's the femur, the thigh, here is the tibia and fibula, the calf. We have cut open the knee joint, and so this here, or these are the smooth articular surfaces that are actually very smooth if you feel them. Another benefit of not wearing gloves if you're up for that. And so smooth articular surfaces are condyles. Right? One more time, this little flappy hard thing here is the meniscus. Right? One other structure I want to point out while we're in the knee, if you're an athlete, maybe you already know about this, but this here, or there is a connective tissue band between the tibia and the femur, right? And if you don't just slice right through the knee, you'll be able to see it's pretty shiny in here, and I know that it's not terribly obvious in the video here, but essentially we are looking at this connective tissue. Oops, difficult to drive this. There we go. This right here. So shiny little band within the knee. And again, the meniscus. Okay. Okay, so that might be another photo, right? These are the condyles. This is the meniscus. This is the cruciate ligament, particularly the anterior cruciate ligament. Okay. All right, so once you have shown me and documented the knee, right, so the cruciate ligament, the menisci, the condyles, now we can cut the knee apart. Okay. From here, let's take a look at the bone itself. All right. So again, kind of gentle movements, right, gentle cuts. We can see more blood vessels if you are slow and careful about this process, right? And now we are really just trying to get the muscle away from the bone. Okay. So just kind of shaving that muscle off. Note that there are lots of different connections all around the bone. Right? So what you are cutting are origins and insertions of these muscles. Right? So that is what you are cutting through. Okay. All right, so now that's chicken tender, and here is your femur, or his femur. And again, the head of the femur, there's a bump over here, the greater trochanter, and all